All right, my name's Sherman. I'm going to be your nurse for your assessment today. That is the cardiac and peripheral vascular assessment. Can you start by telling me your name and how old you are?
James, and I'm 36 years old.
Okay, we're going to start with your upper extremities. They are symmetrical. You have even hair distribution. They are warm and dry to the touch. Your cap refill is less than 2. I'm going to check your pulses. This is your radial and this is your brachial. All right, you can relax. I'm gonna next assess your carotid arteries and your neck. I'm gonna palpate and then I'm gonna listen. I'm gonna check in 3 spots, one at a time. All right, and then next I'm gonna listen. I'm gonna have you take a deep breath and hold it when I say, and I'm gonna listen with the bell side. You take a deep breath for me and hold it. All right, you can breathe normally. And take another deep breath and hold. All right, you can breathe normally. All right, next I'm gonna listen to your heart sounds and I'm gonna name them as I go. I'm gonna start with the diaphragm side. This is your aortic. It's on the right second intercostal space. Your pulmonics on the left second intercostal space. Your Erb's point is the third on the left intercostal space. Your tricuspid is the fourth intercostal space on the left side, and then your mitral is on the fifth intercostal space, midclavicular. All right, I'm gonna listen again with the bell side. This is your aortic, your pulmonic, your Erb's point, your tricuspid, and your mitral again. All right, I'm gonna have you lay down for me, please. And I'm gonna have you look towards the wall. I'm gonna check for jugular vein distension, none noticed. Can you look towards me now, please? All right, no jugular vein distension noted. Next, I'm gonna palpate your pericardium area. This is your aortic, your pulmonic, your Erb's point, your tricuspid, and your mitral. And it's also where your apical pulse is at. And I'm gonna take a listen next and name them again. I'm gonna start with the diaphragm side, your aortic, your pulmonic, your Erb's point, your tricuspid, and your mitral. All right, we're gonna do the diaphragm or the bell side, your aortic, pulmonic, your Erb's point, your tricuspid, and your mitral. And can I have you turn on your left side for me? All right, you can lay back. All right, next I'm going to assess your lower extremities. Your lower extremities are symmetrical. Hair distribution is even. I don't notice any edema anywhere. I'm going to check your pulses. These up here are your femoral, your popliteal behind the knee, then your posterior tibial right here behind your ankle, and then your dorsalis pedis. All right, you can go ahead and sit up for me. That'll conclude our assessment. Thank you. All right, this is the report for a 36-year-old male patient who came in for a cardiac and peripheral vascular assessment. The upper extremities were symmetrical, hair was evenly distributed, skin was warm and dry to the touch. Radial and brachial pulses were palpated and they were strong and equal bilaterally. Skin turgor was checked on the back of the hands and it was noted to be elastic. Cap refill was less than 2 seconds. Next, the carotids were assessed. Pulses were equal and strong bilaterally. No bruit noted upon auscultation. Patient's heart sounds were next listened to. They were listened to with the patient sitting and lying during the assessment. Educated patient on the location of heart sounds, the aortic, pulmonic, Erb's point, tricuspid, and the mitral. When the patient was laying down, no JVD was noted. Pericardium was inspected and assessed and palpated. No tenderness or lumps, bumps, bruises were noted. Palpated patient's aortic, pulmonic, Erb's point, tricuspid, and mitral heart sound locations. No tenderness was noted. Educated patient on apical pulse. Apical pulse was noted to be 72 upon assessment. Patient's lower extremities were symmetrical bilaterally. Skin was warm and dry to the touch. Hair was evenly distributed. No edema was noted on the upper and the lower extremities, and no varicose veins were noted on the lower extremities. Patient's pulses were palpated on the lower extremities, being the femoral, popliteal, posterior tibial, and dorsalis pedis, and they were strong and equal bilaterally. This concludes the report. Thank you.